Welcome to the Naturally Healthy Pets Podcast. Let's get to it.
Hello, everyone. I'm Dr. Judy Morgan. You're listening to Dr. Judy Morgan's Naturally Healthy Pets Podcast. My guest today is Dr. Todd Cooney. He is a practicing homeopathic veterinarian with nearly 40 years experience, though the first 20 years was allopathic. He's done things both ways and can say the holistic, natural way is by far most excellent. I like that, most excellent. Now he is eager to spread the word whenever possible and help people take their animals along the natural path to good health. Dr. Cooney, thank you for being my guest today.
Thank you. My pleasure, Judy.
So, homeopathy. How did you get started in homeopathy? Because you practiced allopathic medicine for 20 years, so something happened.
I did. Yeah, something happened. Exactly. Well, I was getting a little disgruntled with allopathic medicine, and I wasn't sure why. I just was getting kind of burnt out, close to the 18, 19-year mark. And I guess that's pretty typical, of a lot of vets from what I understand.
I got burnt out at the 10-year mark, so.
Yeah. Maybe I was burned out then, and I just was stubborn. But then I had a real health issue myself, a serious health crisis, and in seeking treatment for myself, I was seeing a lot of specialists and experienced doctors, and nothing was really helping me. And all they could do was try one drug after another, and I was getting really frustrated. And the main problem I was having was seizures. And so I couldn't really work very well. I couldn't drive. It was really affecting my life. So my sister recommended a Chinese medicine acupuncture doctor to me. And I went and saw her one day, and not really thinking, very high hopes about it. But to my amazement, it helped a lot. And after the first visit, I felt like a new person almost. And so I kept going back and did that over the next year or so. Thought, well, I'll take acupuncture training myself, and I'll work this into my practice. So the course was full and a long waiting list. So I was looking for other options. I thought I'll take something holistic. I don't really care what it is at this point. I was just ready to change paths. So I found the homeopathy course with Dr. Pitcairn, and they had one opening left for the upcoming class. So I signed up, and I didn't even really know what homeopathy was. Except from a little bit of experience I had in Germany when I was in the military. But so I took the course and wondered what in the world I was doing, even as I was taking the course. But after about 3 or 4 months, I started using it in my practice and started seeing it working in a few cases, and thought, okay, well, I'll stay with this. This is going to be worth it, I think. Yeah. And it has been. Now, I can hardly think. I can hardly use my allopathic brain anymore. I have trouble remembering drug dosages and things like that because I think of remedies all the time. And so it's been a great.
It's really interesting transition. when absolutely. And when you learn something like homeopathy or Chinese veterinary medicine, it's almost like learning to speak a new language. And,
exactly.
I've got friends who went to vet school in Italy or Germany. Yeah. And I'm like, okay, do they teach in English? No, they teach in Italian. They teach in German. Did you know Italian before you went over there? No. How do you possibly go through vet school not even speaking the language you're being taught in? But crazy. I feel like, when I first started learning Chinese medicine, we're talking about damp and heat and wind, and it's just like, and spleen. Yeah. That's that little brown thing that sits next to the stomach, or not.
No. Yes, I know. And you have to unlearn your...
So totally different.
Unlearn your allopathic thinking. You have to get away from that. And Dr. Pitcairn told us that veterinarians are the hardest people to teach homeopathy to. He said he'd much rather teach a layperson because they don't have all this baggage that they've learned in vet school, And
that is interesting. That is very true.
Yeah.
Yeah. I could definitely see that. So one of the things that you've incorporated into your practice, and what we want to talk about today, is the use of nosodes. And I'd like you to explain what those are, because we're going to talk about the use of nosodes instead of vaccines for parvovirus. And I know that people just freak out thinking I absolutely have to do this. So I have a good friend who is fairly holistic, but could not bring herself to not vaccinate her puppy.
Good story.
And including, the set of parvo vaccines, the set of distemper vaccines, and Lyme, because she lives in a high tick area. And of course, at 9 months of age, the dog has meningoencephalitis. And I'm like, I told you, don't go with all these vaccines. Don't go with all these vaccines. It's going to cause trouble. And shocking, we have an autoimmune disease after all these vaccines.
Shocking.
So, yeah, shocking. So how do you move away from this in your practice? Because your practice, you do a lot of homeopathy, and I don't think do you give any vaccines at all?
The only vaccine we even have is rabies. We have that in the practice. We don't even buy any of the other vaccines. Haven't really since about 2009. We just stopped. I stopped ordering them. I said, well, I'm going to be tempted to use them once in a while if they're in the fridge. If I have them, someone's going to talk me into it. And so I just went cold turkey and quit buying the vaccines except for rabies. And the only reason I would rather have a practice where I don't give rabies vaccine, but people need that a lot of times as a legal requirement for other things, grooming, boarding, training, traveling.
How do you get around the grooming, boarding, daycare with distemper and parvo requirements and bordetella requirements?
Well, we use a nosode from Hahnemann Labs, and nosodes are just homeopathic medicines that are made from disease. So, like a distemper nosode is made from distemper. A dog that had distemper, parvo is made from parvo. They take all the gross stuff from the animal, the vomit, the diarrhea, the blood, and they take all that and make the nosode with that. So it actually includes the animal's immune response to the disease along with the agent, the disease agent. So it really is a pretty holistic approach because it contains all that. It's not just like there are tautodes. Tautodes are remedies made from a vaccine, and that's not what we're talking about. We're talking about a nosode, which is made from the disease. Okay. So anyway, to get around that requirement, or to try to get around it, we use combination nosodes. So our combination nosode for a dog has distemper, parvo, hepatitis, kennel cough, lepto, influenza, and rabies combined all in one nosode. And so on the printout for the client, if they come in, they get that. On the printout, it says DHLP, kennel cough, and influenza. We leave off the rabies because we don't want to cause confusion, and it doesn't count as a rabies vaccine anyway. So we just don't put that on the description. But then the client can take that and say, here, my dog had his DHLP, bordetella, kennel cough. And it's not being sneaky, really, because on the page it says it's a nosode. So we're honest about it. Some of the places will frown on it, and they'll say, we can't accept that. And sometimes they'll want to ask me more about it. They'll have questions. And then I can point them to studies where nosodes have excelled above vaccines in treating diseases. There's been a lot of examples over the last 200 years, and especially in the last about 80 years, there's been a lot of examples. So, it's easy, including my experience with parvo, which, no one's really published much about that yet, and I intend to publish it eventually. I'm waiting until I get enough numbers. I want my numbers to be high enough that AVMA would have to say, okay, well, we might at least give you a letter to the editor article,
Well, sometimes those letters to the editor are taken as factual studies.
I know.
That's how we got the whole DCM grain-free debacle.
I know. Well, I don't think they would let it publish as a scientific, retrospective study or something. But I don't know. Who knows? So
who knows? So you've been using nosodes. So you got rid of vaccines completely, like 15 years ago.
Yeah, except for rabies. Yeah.
Except for rabies. So how how are you treating these puppies that come in? So you're giving them, do they all get the nosodes?
I would say 95% of them plus, because if someone comes in, like if they call in, they say, hey, I have a new puppy. He needs to come and get his puppy shots. We say, okay. And usually over the phone, they'll say, well, we have a puppy wellness package you might be interested in. And that includes all the nosodes that they need, deworming if they need that, and supplements, usually standard process. So it's a package deal and they get everything at a discount. And so most people will go with that, whether or not they know what a nosode is, and then they come in, and if they don't know what it is, we'll talk about it and explain it to them so they're not confused, because a lot of folks, if they are expecting a vaccine, they're surprised when you come in with a dropper bottle and you just put a few drops in the mouth of the puppy and there you go. That's it. And
it's our new
take
oral
this
vaccine.
home and do this at home. It seems too simple, and at first I had a lot of clients that kind of balked at the idea because how does this really work? How does this work? And I had the same doubts in my mind because I hadn't had any experience with it. I was going by the word of other homeopaths who had done it before me and had good experiences, and I was trusting their word. So
you've been doing this for quite a while. We're going to take a break, but when we come back, I want to talk about the results that you're getting, the number of cases that you're seeing, the outcomes of those cases of parvo in these dogs that are getting nosodes instead of vaccines. Stay tuned. We'll be right back.
Are you ready to prepare complete and balanced meals at home for your dog with confidence? Let Dr. Judy take the guesswork out of home-prepared food in Homemade Food for Dogs 101. Once you purchase this fun and easy-to-understand course, you will have permanent access and can re-watch at any time. Take advantage of a 20% discount on this fabulous course where Dr. Judy helps you feel comfortable making safe and balanced meals for your dog using fresh whole foods. Use code podcast61 when purchasing on drjudyu.com. Your dog will thank you. Dr. Judy Morgan's wellness formula for dogs and cats is made with all natural ingredients sourced from New Zealand and can be used routinely to maintain overall physical and mental well-being. This amazing product supports healthy joint, brain, immune, gut, and skin function. It can be used in pets of all ages. Use code podcast61 for 10% off as our thanks for listening. We appreciate you, as your support helps us educate and empower other pet lovers worldwide.
Welcome back. I'm Dr. Judy Morgan, and this is the Naturally Healthy Pets podcast. My guest, Dr. Todd Cooney, and I are discussing using nosodes instead of vaccinations. And we're talking about parvo and we're talking about puppies, but I would think you're doing the same thing for kittens as well. They're getting nosodes instead of vaccines as well, correct?
Correct. Yes.
All right. So you've been doing this for about 15 years. How often do you see cases of parvo in these puppies and I'm sure some puppies come to you that already have some vaccines on board, depending on where they were purchased. The breeder may have given them, the pet store may have given them. So do you see a difference in the two populations?
There can be a difference. Yeah. The biggest risk with puppies that have been vaccinated is we found they're the ones more likely to get sick with parvo. And if they do get sick, they're more likely to die compared to the unvaccinated group. And we've proved that by comparing the numbers over the years, and it's pretty striking. It's not a small difference. It's not like 50% to 40%. It's like 100% survival with nosode puppies and 25% survival with vaccinated puppies. So it's pretty drastic.
And do you see a difference in what age that vaccine was given? And, because for those who want to vaccinate, what I went to in my practice, because I'm not a homeopath and I didn't do nosodes, but I think I would now, we would, if at all possible, if the puppy came unvaccinated, we would wait until that puppy hit about 14 weeks.
Yeah.
And I would give them their distemper at 14, a single distemper, and then a single parvo at 16. And
Right.
that one vaccine would give us much stronger titers than the poor animals that had vaccines every 2 weeks, starting at 6 weeks. Craziness.
Yeah. Right. Yeah. And that's a much better way, I think, to do the vaccines if you're going to do them, is just to split them up and wait till the puppy's a little bit older. With the nosodes, the nice thing is we can start at any age. We can start when they're 8 weeks old. We can start when they're 4 months old. We can start if they've had vaccines or if they haven't had vaccines. It doesn't really matter, because the nosode works so differently than the vaccine. Even a pup who's been through a full series of puppy shots can still benefit from nosodes. I think because they enable the natural immunity to be a lot stronger than a vaccine does. A vaccine really interferes with natural immunity. And that's been proven a lot, especially in measles in children. They've done a lot of studies with that, proving that vaccine immunity is really inferior to natural immunity. And with COVID, that was pretty obvious too.
Yeah, I just read a big long book on natural immunity with COVID versus vaccine immunity, and it's really interesting the number of people that have had vaccines that repeatedly keep getting COVID versus. And I'm going to knock on wood, I haven't had it. I think I've been exposed a few times, and I think I'm natural immunity.
Yeah.
Stay in.
I think I've had it too. I've never done the test, or if I have been tested for traveling or something, it's always been negative. But that was when I was not having symptoms. So
so
when I've
who
had
knows?
symptoms, I don't know.
So do you, with these animals that you give nosodes, will they develop a positive titer if somebody wanted to do a titer test? Have you done any studies with that?
No, and that's one of the things I would like to do down the road. I think it'd be interesting to titer these pups. I think I would titer them.
I have talked to some people who have, and they're getting amazing titers. 1 to 2,000 instead of 1 to 80.
Yeah, and it could be because of a stronger natural immune system. Natural immunity. The nosode itself doesn't trigger a titer. It's not like a vaccine where you give a vaccine, and especially with the adjuvant added to the vaccine, it sparks a strong response, which gives you a titer. So, but Dr. Pitcairn has said over and over again in our meetings, and he really has to pound this into the head of some of our younger members. Last time at our meeting last February, he got right in someone's face and he said, "Titers don't reflect immunity." and he's a PhD immunologist, so I would take his word for it. And
I think the big reason we're stuck on titers is because boarding, grooming, daycare.
Well, it's an alternative. It's an alternative to vaccines that conventional people are comfortable with.
Right.
In some cases,
they want some sort of proof.
Yeah. And they also want some sort of revenue because vaccine hesitancy has become a big thing. The AVMA even addresses it now in their journals. Vaccine hesitancy, the problem, and what are we going to do about it? So, what they're not doing about it is educating veterinarians on why people are vaccine hesitant. They're just doubling down on telling people they need to vaccinate. That's their approach, and I think it's the wrong approach, honestly. But I think they should be questioning, why are all these people questioning vaccines? And it's not really all of a sudden. It's been going on since vaccines started with smallpox.
It's true. And I think that, like you, with your illness and going to allopathic doctors and, more drugs, more tests, more this, and nothing's getting better.
Right.
And so many of our pet owners are dealing with the same thing. I'm in and out of the veterinary office every other week. They're still itching. They still have yeast infections. They still have diarrhea. They're still not thriving. And, then they get on the internet and people like us talk and they go,
we know why. We know why they're sick.
maybe the 27 vaccines that I was made to give the animal have something to do with this.
Well, in the third session of my homeopathy training was 5 sessions. The third session, Dr. D. Blanco, who lives in New Mexico and practices, she's one of Richard Pitcairn's early students. She came in to be a guest lecturer that time. And the first thing she said, that session was all about vaccinosis, which is the disease caused by vaccine. So we were introducing the topic of vaccinosis. And she said, "Hi, my name is Dee Blanco. Everything you see in practice is vaccinosis." And I said, "Wow, that's kind of a blanket statement." Okay, well, but I think she's right. I think it's hard to find something. Well, okay, if a dog goes out and get hit by a car, that's maybe not vaccinosis, unless the vaccine made him, crazy and he ran in the road. But literally, most chronic disease is probably traced to autoimmunity, which is most autoimmunity is traced to vaccines. My vet school did a study on that in the 90s called the Purdue Vaccine Study, and you can Google it if you can still find the study, because it's hard to find now. But they proved that vaccines caused autoimmunity 100% of the time, not 95, not 98, 100%. And unvaccinated animals vaccinated with placebo, 0% developed autoimmunity, 0. So when it's 100 to 0, you can fire. You don't need a statistician. You don't need to hire a statistician. You can do that yourself. I can figure that one out.
That's pretty stark. But that's what you're seeing in your practice with puppies given nosodes. The very few that do develop parvo. How many did you say you've had?
Well, over the years we've had I'd say probably 80 or so, but most of them were before 2014, and that was about 4 years into using nosodes. 2016, we changed our dosing protocol to giving the nosode weekly. Before that, we were giving it monthly or twice every 2 weeks. So once we changed to weekly, the cases really bottomed out, really dropped. And that's when we started hardly seeing cases at all. And we haven't really seen a case. Well, I think we saw one earlier this year, but we hadn't seen others since 2018 in the puppies that were taking the nosode. And that's really whether they've been vaccinated or not.
So you're giving that weekly. Are the clients giving the nosode at home?
Yes, they are. Yeah. We make it up in a dropper bottle in a water solution, and we show them how to do it. And the hardest part is keeping the dropper clean, because the puppy wants to lick the dropper, and you will drop it on the floor. And so keeping the dropper clean is important to keep the solution in good shape. But we show them how to do it, and we say, just do this once a week till at least 6 months. You can go longer than that if you want, and that's the end of it. I mean,
and so they do that when they're youngsters. Then is it something, of course, the veterinary community wants everybody to come in every year and get boosters on everything. Do you have to do that with the nosodes, or is this, once you get through that 6 months, you're good to go forever?
Yeah, they seem to be good to go after that. Some people want to do it on their own and do like a yearly booster. Some people will do that, especially the combination nosode. They'll give that once a year because I think it makes them feel more comfortable. Their dog is hunting or their dog's boarding. And so the boarding people especially usually have to give it because of the Bordetella. So they'll meet that Bordetella requirement with the nosode. But really, Dr. Ron Schultz, he proved pretty much that dogs have solid immunity by the time they're a year old to just about everything, and they don't need more stimulation. So we kind of rest.
I wish we could get that through the shelter and rescue.
I know.
Medicine people. It's like if a dog comes into the shelter and it stays there for a while as an adult, it's going to get another whole series of vaccines. It's not even one. And I rarely get dogs from a shelter, but my one of mine that I got, he was a supposedly old blind deaf cocker, and landed in the shelter. And who's going to adopt an old blind deaf cocker except for crazy people like me? But the poor guy, when we got it, so when we got him, I looked at the paperwork and it's like, oh my gosh, he got Bravecto, he got HeartGuard, he got every vaccine known to dog kind. It's like, really? And by the way, he wasn't 13. He was probably like 6. He had juvenile cataracts, so he couldn't see. But, it's just these dogs are in such stressful situation. And then we pound their immune system with something that's going to take a couple of weeks to take effect anyway.
Right.
So it just, I don't know how we change shelter medicine. I think that's a long road.
I have a dream that shelters will eventually at least look at nosodes. I've talked to a few shelters here in Indiana, and they seem interested at first, and then they never really follow through, My son worked at one of the biggest shelters in Indianapolis, and they always had at least 100 dogs in the shelter at any time. And they were interested. I said, this is something you could adopt. It would save the shelter a ton of money, and you'd have healthier animals. I mean, you wouldn't have kennel cough in your shelter. You wouldn't have a lot of things probably, but they just couldn't do it. They had a higher up board member that was a veterinarian, and I think he shot it down. So
getting past the traditionalists is going to be really, really, really tricky. But I will say in my practice area, we did a lot of titers because that was the only way we could get our clients' animals into boarding, grooming, daycare, whatever.
That's the golden ticket, right? That's the golden ticket.
So we would do titers every year just so if they weren't going to those places, I was like, well, then you don't need it. Who cares? But if they needed something to get in the door, we would do that so that they could get in the door. But it would be so much. And so we educated the boarding, grooming, daycare in our area. And I'm sure that because of what you do in your practice, you've been able to educate a lot of those facilities in your area. And it's really helpful to have a veterinarian in that corner.
We have one kennel who won't.
I can't believe it.
One kennel won't accept our dog's Bordetella. If we gave it, they won't accept it. They call it our mystery drops. They said they use mystery drops. We can't let you board here. So
my old business partner called it black magic and voodoo, and I was like, well, it's working, so it's all good.
It works. I have a trainer friend who ran a boarding training facility. He wouldn't let dogs come in if they'd recently had the Bordetella because they would shed it, and he didn't want that, so he made him wait at least 3
Smart
weeks.
Man.
And it really cut down on his problems.
Yeah. We tried to get the kennels to do that too. We are out of time. You're just a wealth of information for anyone wanting more information about homeopathy. Dr. Todd Cooney, his website is naturalanimalconsulting.com. That will be in the show notes. Everyone check that out. This is great information, and maybe I should have gone a little deeper into that homeopathy thing. I love that you've been able to give up the vaccines, and hopefully you will have amassed all that data, can get it published, and get some proof out there that this is good stuff. This works.
If nothing else, I can do an ebook. I know. So I'm kind of working on a little ebook.
There you go.
So look for that.
That would be amazing. We would be happy to point people to that.
Thank you.
There you go. Thank you very much, Dr. Cooney. Have a blessed day, week, month, year, and thank you for everything that you're doing.
You too. Thanks so much.
Thanks for listening to another great Naturally Healthy Pets episode. Be sure to check out the show notes for some helpful links. And if you enjoy the show, please be sure to follow and listen for free on your favorite podcast app. We value your feedback and would love to hear from you on how we're doing. Visit drjudymorgan.com for healthy product recommendations, comprehensive courses, upcoming events, and other fantastic resources. Until next time, keep giving your pet the vibrant life they deserve.
The purpose of this podcast is to educate and to inform. It is no substitute for professional care by a veterinarian, licensed nutritionist, or other qualified professional. You're encouraged to do your own research and should not rely on this information as professional medical advice, diagnosis, or treatment. Dr. Judy and her guests express their own views, experience, and conclusions. Dr. Judy Morgan's Naturally Healthy Pets neither endorses or opposes any particular view discussed here.